Thank you all so much for joining us here today for our Doctors in webinar. My name is David Griffith. I'm the Director of Programs and Outreach for the LGBT Elder Initiative, and I'm very happy to have you with us today for our Doctors in program on advanced care planning. As many folks who have been with us before know, the Doctors in is a collaboration between us at the LGBT Elder Initiative and the Jefferson Center for Urban Health and the Jefferson Department of Family and Community Medicine. And we do these as a monthly program series to talk about different health topics relevant to aging in the LGBT community. And so we're very lucky to be joined today by Dr. Zach Klock, who is a hospice and palliative medicine fellow at the Jefferson Department of Family and Community Medicine. And he will be leading us through today's presentation on advanced care planning. Just a couple of notes for anyone new to our Zoom webinar setup. You can ask your questions at any time, either through the Zoom chat feature or through the Q&A button, which you should be able to find in your toolbar at the bottom of your Zoom screen. The things you put in the chat will be visible to everyone. The Q&A, there is an option to submit your questions anonymously if you are more comfortable asking questions that way. And Billy, our wonderful social work intern, will be keeping an eye on the chat and the Q&A feature and relay those questions to Zach. Anyone watching us on Facebook, feel free to pop your questions into the comments, and I will relay those to Zach as well. So thank you again for joining us. And without further ado, I turn it over to Zach.
Awesome. Thank you so much, David. It's great to be with you all on this chilly fall day. We're going to spend the next 45 minutes or so talking about advanced care planning, which is really an important topic to everyone, particularly as we get older. And I'm hoping that, this can really be a conversation. So as David said, feel free to use the chat function and we'll kind of answer questions as we go. People are probably coming into this with different, backgrounds and different experiences with advanced care planning. We may have people who've, never heard the word or never thought about advanced care planning. We may have people who have had experience with this in their own lives and, people who may be coming in having already written down an advanced directive. And so hopefully this will kind of be informational for people at all stages of thinking about and discussing advanced care planning and can help to kind of continue the conversation for all of you. In terms of our outline today, we'll talk about, we'll define and discuss the purpose of advanced care planning, understanding the different parts of it. We'll look particularly at the Pennsylvania Advanced Healthcare Directive. I'll share some resources with you guys that I have found particularly helpful, and I think a lot of my patients find helpful as well. And then kind of allow time for discussion at the end. But like I said, feel free to submit questions as we go. And I'd just like to acknowledge my colleague, Dr. Brooke Salzman, who's a geriatrician at Jefferson, who I based some of these slides off of. So in terms of thinking about and defining what advanced care planning is, it really involves discussing, making, and documenting decisions about the medical care you would want to receive for yourself if you become unable to speak for yourself. So, when I'm talking with patients and families and we're trying to figure out the best next step, I like to say to them, if you were able to be a part of the conversation that your doctors may be having with your loved ones, what would you say if you were at that table with us? Advanced care planning is important. Many older adults, 3 out of 4 at some point in their life, will be unable to make some or all of their medical decisions. So really kind of thinking about planning in advance for if you are one of those 3 and 4 adults can be really helpful. And if you're unable to make the medical decisions at the end of your life, your medical team would want to know who you would want to make those decisions and what kind of decisions you would make. So it's really kind of planning for the future and what kind of medical decisions you would make for yourself if you, God forbid, are unable to make them for yourself at any point. In the LGBT community in particular, advanced care planning is important for a few specific reasons, one of which is that, many LGBT older adults may have understandable difficulty relying on medical institutions that historically and in the past have really kind of stigmatized their needs, their sexuality, their gender identity, really medicalized it and treated it as a quote unquote sickness. And we also know that, for many LGBT adults in general, in particular older adults, rather than relying on a quote unquote biological family, they may have what some of the literature calls a logical kin or a quote unquote chosen family. And so for LGBT individuals in particular, advanced care planning allows us to, recognize these logical kin or chosen families and really kind of designate the most appropriate person to make medical decisions for us who may not be, the biologic next of kin that is recognized within Pennsylvania laws. And we know that within the LGBT community, there's particularly low rates of having advanced care planning discussions between individuals and their healthcare providers. Some studies have shown that only 10% of LGBT individuals have ever discussed advanced care planning with their providers. And in the trans community in particular, that's 50 to 70% lower. So we know it's incredibly important to our community in particular, and it's something that we're not doing as much as I think that we should. So hopefully this can begin the conversation between us, our healthcare providers, and our loved ones into advanced care planning. So when should your advanced care planning be done? The answer is now. It's always better to begin to think about and discuss and have these conversations when you are healthy enough to be able to talk about it. When you're not in a high stress situation like being admitted to the hospital, God forbid, or being faced with a serious medical decision. It's much easier to start these conversations now. So I'm glad that you're all here with us so we can start thinking about it together. In terms of kind of how I think about the parts of advanced care planning, the first is choosing and we'll go through each of these in more detail. The first is choosing your medical decision maker. The second is thinking about and deciding on your own healthcare choices and what kinds of things you may or may not want. Number three, in my opinion and experience, is really kind of one of the most important, which is discussing your choices and values with your loved ones and your medical decision maker in particular. And then kind of the final step of this is completing and signing a form or a document, which is called the Advanced Directive or the Living Will, as it's colloquially called, to really kind of document all of these things formally. So the first kind of part, as we said, about advanced care planning is choosing your medical decision maker. So your medical decision maker is the person who would make healthcare decisions for you if you're not able to make them yourself. Many times someone might call this a power of attorney, is a common phrase that's used. And then legally, when you're actually looking at paperwork and filling it out, this will be called your healthcare agent. Some people may call it a proxy, some people may call it a surrogate. These are kind of all similar terms that are basically designating the person who you are choosing to make medical decisions for you if you are unable to do so yourself. When we're thinking about who we should be choosing for a medical decision maker, some important things to think about. In general, you should choose someone who is 18 years or older, so you should choose an adult to be your medical decision maker. You should choose someone who you feel comfortable talking about your wishes and your values with, and who you trust to follow your wishes and do what is best for you. You want them to be someone you trust with your medical information, because this is the person that the medical team will be coming to, will be sharing any medical information with to help make decisions. You want someone who is going to really speak up on your behalf and not be afraid to ask questions of your medical team. And it's important that you not choose a member of your medical team. So you shouldn't choose your physician or a nurse in the doctor's office that you go to who you connect with really well. It really should be someone kind of outside of your immediate medical community. If you don't choose a medical decision maker, and if you don't formally document a medical decision maker, then a person would be designated to make decisions for you according to Pennsylvania law. And as I alluded to earlier, it's really, the law is kind of really around biologic families and kinship. So for many people, this would be a parent, a sibling, a child, if they had one and they were an adult, would be in Pennsylvania law, some of the more common people who would be designated your surrogate decision maker. And like I said, this may or may not be the person who you want to make medical decisions on your behalf. Even if the person you want to make medical decisions on your behalf is the person who the law would designate, such as a spouse or a sibling, I would still recommend that you formally document through an advance directive who your healthcare agent would be. Just because if you were to be in a situation where they need to make medical decisions for you, it gives them kind of a little bit more autonomy and flexibility in terms of decisions that they can and cannot make for your healthcare. In thinking about kind of what choices a medical decision maker can make on your behalf, they can really make any choices that you would make for yourself. So they could choose who your care team is, they could choose what physician they bring you to see, what nurses are involved in your care. They would have choices around, what hospital do they bring you to. If you were in a position where you needed a nursing home or a nursing home level of care, or to go to a rehab, they would help to decide things like that. I think most importantly, and where we, oftentimes rely on medical decision makers, is to really help decide on tests, treatments, and interventions. So this is where, if we need specific medications, if we want to treat you with a certain medicine that may have some side effects, we would talk about that with your decision maker. If we were in a position where you were having difficulty with breathing and we needed to talk about a ventilatory machine or surgical procedures for any sort of reason, these are all things we would go to your medical decision maker about, discuss the benefits, the costs and the benefits, the pros and the cons, much like we would if you were able to speak for yourself, and help them to come up with a decision about what you would want for your own behalf. They can also help to decide who has access to your medical information, who's able to get updates about what's going on should you be in the hospital, for example. And then if you are to pass, they can make decisions regarding your body and organ, things like organ donation and whatnot, are all things that medical decision makers can make for you. Kind of one final thought on medical decision maker is, this is really, I want to emphasize a person who you really trust to make the best decisions on your behalf. And, sometimes that is a family member, but it's not always a family member. And if you have a friend, a neighbor, colleague, something like that, who is really the person that you trust and you want to make medical decisions, then you are able to designate them as such. It does not need to be, someone in your family. So after you've kind of thought about and decided who might make your medical decisions, you're going to think about deciding your own healthcare choices. And this is number two and number three really kind of go hand in hand. It's not necessarily a sequential step or order that you need to choose a decision maker, then decide on your own, then talk about it with people, and then formally document. I think, talking about your values and what you would want is maybe even more important than the deciding it itself. It's really a process about thinking about what's important to you and what you would or would not want. So in terms of deciding your own healthcare choices, this is kind of the part of advanced care planning that allows you to communicate the kind of healthcare that you may or may not want. I like to remind patients or encourage patients to think generally about what's important to you. There are so many different scenarios, things that could happen, questions that you could be faced with. Well, what if this, then that? What if this, then that? That it's really impossible to predict, and it's impossible for you have made a decision for yourself about every little possibility that could happen. And so I don't want you to stress about trying to think through all of those different scenarios, but to rather really think generally about what is important to you. And when I show you a couple of resources that I like later, we'll really see kind of how this can play out in advanced care planning about thinking generally what is important to you. I encourage patients to reflect on other interactions that they've had with the healthcare system. Think about your friends and your loved ones, and what sorts of positions have they been in? Have you seen someone who was on a ventilator? Have you seen someone who needed a feeding tube? Have you seen someone who needed a certain medicine? Kind of think about those experiences that you've had and how those have impacted you, and what your thoughts or reflections are on those. When it comes to thinking about your healthcare choices, there are no right or wrong answers. This is really about your own values and your preferences and your discussions with your loved ones. So, your values are your values, and the important part is that you understand and explore those, and think about what decisions are right for you. And I think that sometimes this can be daunting or overwhelming, and sometimes people don't want to think about, you're healthy, you're not having any medical problems, you're not in the hospital, you're not facing, an acute medical decision, so you don't want to think about it. You don't want to think about if you were to get sick. And I remind people that some of the hardest situations that I deal with in the hospital is when a patient can't speak for themselves and family members and loved ones are really struggling to think about and to make decisions that are on the best or in the best interest of a patient. And so I really do think that thinking these things through and talking with your loved ones about it is really a gift that you are giving to them, to help take some pressure off of them during what can be a really stressful and anxiety provoking situation. So kind of tied into thinking about what's important and what decisions you would make for yourself is discussing your choices and values with both your medical decision maker and kind of your generalizable social circle and people who are important to you in your life and your loved ones. I really do think that, this is one of the most important parts. Documenting and having a formal document that says what you may or may not want is really important. But I think that talking about it with your loved ones is the most important thing, because then it will help them to make these decisions if it really comes down to it, rather than just kind of looking at a document that you've filled out maybe on your own, but not talked about with anyone. And like I said, we can't account for every circumstance that may come up. So this will allow you to really explore your values and your beliefs with your decision maker and other support system to help them make decisions for you. It's really important that you tell your medical decision maker that you are designating them as such. So whoever you are choosing, you should let them know that you are choosing them, so that they aren't surprised if, God forbid, something happens and all of a sudden they need to make decisions for you. This is really where you're discussing and exploring your healthcare choices. And like I said, I would consider involving other loved ones. It's not just you and your medical decision maker. It's really who's important to you in your life, who might kind of be there for you, who may be supporting the medical decision maker, so that they know what you want, and it can really help them to come together and to speak on your behalf. Like I said, taking off some of the burden or anxiety from them around some of these pretty stressful situations.
Zach, do you have any sort of tips for how to broach that subject? So if I've identified a friend who I want to, bear this responsibility, it's sort of a heavy ask, and can be a difficult conversation. Do you have anything that you've sort of seen professionally that you would relay to folks as sort of how to bring that up with the person you're going to ask to do this for you?
Yeah, definitely. That's a great question. We'll talk specifically towards the end about a couple of really wonderful resources that I've found in terms of helping people to start and have these conversations. I think, one of the most important things is really normalizing this as much as possible, and kind of talking about it as openly as we can and not making it such a taboo, like thinking about if I get sick or thinking about the end of my life, but rather exploring the values now. So I think the most important part is kind of normalizing it as much as we can. And we'll talk about some specific resources a little bit later. I know for myself, I have had multiple family dinners with the holidays coming up where, it's something that I bring up at Thanksgiving dinner. And my family may not necessarily like it, but I think it's important that we have the conversations and that we share. I also think reflecting around, events that are happening in your life, whether that be a family member or a loved one who is ill or who is going through a serious illness, and reflecting on that with your social circle and thinking about, if I were in the situation that I am seeing now, how would I feel about that? Would I be making those same choices, or would I want something different for myself? That's a great question. It can be a very heavy subject. The more we normalize it, the easier it can be. And then the final part is completing an advanced directive, or this is, sometimes people will call this your living will. So in terms of how you do it, you're basically going to fill out a form that communicates two things: one, who your medical decision maker is, and then two, what your healthcare choices are. I will share with you a couple of resources and kind of walk you through some of the advanced directives and advanced directive paperwork that I like to use. There are some legal paperwork that is, very formal and written by a lawyer and, has check boxes, and I don't like as much as some of what I'll share with you, because two of the resources that I have my patients use really kind of focus not just on the checkbox of do you want X, Y, Z, but really kind of what's important to you and what your values are. And then once you've completed a form like this, your form has to be signed by two witnesses in order for it to be a valid legal document. Many times people ask if it needs to be notarized, and it does not need to be notarized if you follow kind of the rules for the two witnesses who need to sign it. So in terms of who is witnessing and signing your form, they need to, one, watch you sign it. So don't sign it in advance until you have your two witnesses. Your witnesses cannot be your medical decision maker. So whoever you are designating as your healthcare agent cannot be a witness on your form. And it cannot be your physician either. And it also cannot be a healthcare provider, either in your clinic, like your physician, as I said, or in the place that you live. So if you live in an assisted living or a nursing facility, and there's a physician in that facility, that physician or nurse practitioner or PA cannot sign the form as your witness.
I have a question, Dr. Zach,
Yeah,
about that.
absolutely.
So, for the initial visit with Medicare, the physicians are allowed that one time to do the advanced care planning with their patients. So, the patients should take that form out with them and have two other people sign it and then bring it back to their physician. Okay,
Absolutely. Yeah.
thank you.
And when I do those visits with patients, I'm usually kind of focused more on exploring who you would want to make decisions for you, and kind of starting to explore some of the questions around what kinds of healthcare choices you might make for yourself. And then I will often give my patients a packet from one of the sources I'll show you, and ask them to, go through this with your loved ones and fill it out. And then once you fill it out, to bring it back to me. That's a great point. The other caveat to this is that your witness cannot be anyone who would financially benefit should you pass. Basically, they're you don't want someone who has a conflict of interest in your decisions that would benefit from you not being with us. So generally I say, get two friends together, get a family member and a friend together, but not your medical decision maker. And then once you've completed the form, you should give it to your medical decision maker, to any other loved ones who are important to you, and then to your doctor as well. And we will scan these into the system, and they're really easy for us to find within the system. So anyone at Jefferson, for example, who sees a Jefferson PCP or was hospitalized and had a form scanned in, there's an easy button for me to find it should I need it in the future. Sometimes people will ask if they can change their mind regarding their advance directive, and the answer is absolutely. Circumstances change, whether that be your own health or whether that be an interaction with the healthcare system that you have through a friend or a loved one that may change, the way that you think about your health and your own healthcare decisions. So you can absolutely change that, and you can change your medical decision maker as well. It's just important that anytime you want to change something, whether it be part of your healthcare decision making or who you are designating as your decision maker, that you provide an updated document, that you fill out a new document and make sure that it goes to your physician or your provider and your loved ones as well, so that everyone has the most updated kind of information from you. I'm going to show you guys a couple of advanced directives now and just some other resources that I really like. Are there any questions that have come up thus far that we didn't answer?
We just got a Facebook comment approving of the answer of how these decisions can change, and it's important to know that they can change. But I think you got to it before the comment was even up there.
Awesome.
Before
yes,
I saw the
absolutely.
comment.
They're very dynamic.
One question that I know comes up sometimes for folks who maybe don't have someone in mind, or feel like they don't have someone in their life close enough to trust with that responsibility. Are there resources out there for, if I want to pay a company to, be my advance or be my healthcare proxy, or sort of what you would recommend in terms of sort of thinking through who the people in your life might be, even if there's not sort of an obvious choice right now for who would be that proxy?
Yeah, that's a really great question. I don't know of any kind of resources in general to help with that. I know, there is an idea of guardianship and having a lawyer be your decision maker, which is a very different process. But there are certain, I would imagine that there are people out there who are willing to be medical decision makers if need be. I will say in my experience, I've not run into that situation. I think thinking about the people in your life who are not just, I think people oftentimes think that it needs to be a family member or a loved one, and just kind of emphasizing that that's really not the case. I have many patients who I care for whose decision maker is, their next door neighbor who looks out for them every once in a while, or is, their person who drives them back and forth to dialysis, who they may not, be particularly close with, but it's someone they trust and someone they have a relationship with. So I don't know of particular resources, but I think, thinking about not just your family, but if there are other people, no matter how close or not close they may seem in your life, who you think would act on your behalf. I have a lot of people who use their neighbors, which I think has been interesting and has, worked out well, and they act on your behalf just as well as anyone else.
Yeah.
Great
I know
question.
obviously COVID is top of people's minds right now. Does any of this look differently? I mean, in terms of like getting two people to witness something, are there any sort of workarounds with technology and telehealth? If people have not completed these things before, but because of COVID are really feeling the need to right now?
Yeah. So I think one of the kind of, in my experience, I think that a lot of times people feel like they need to have a written down, signed document that says what they would want and things like that. And I will say it is very rare in my experience that I am actively seeking out someone's advanced directive to help their care team make decisions for them. I think the most important thing to be doing right now, if you have not really thought about advanced care planning, is really thinking about who you would want to make decisions for you, and sharing that information with them, and sharing that information with your other loved ones. Because based on my experience alone, particularly in the hospital, admitting patients during COVID, I will, if they are in a state where I can ask them, I will ask them who you would want to make medical decisions for you if you were not able to do so yourself. And I document that in my note. And that's really the person that we go to and that we contact throughout the process. And as long as there are no speed bumps or hiccups or people coming into the picture saying, no, they would want me to make decisions, or no, they want me to do it, then we really kind of rely on that person. When we really start thinking about and getting concerned about paperwork is if there are either disagreements, amongst the family members or loved ones about care plan or about who would make decisions, is when we start thinking about, well, what have they previously documented? So I think that the most important part is thinking who would make your medical decisions, letting them and your loved ones know. I think if it's not someone who is in your family, or is not, your spouse or your partner, I would highly encourage you to document it. I would encourage everyone to document it, but particularly if it's not someone who we would typically go to, thinking about the law, who we would go to. Does that answer
Actually,
that for you?
got another question in on Facebook on the topic of COVID. So has COVID changed anything around talking about DNRs and ventilators that, maybe in someone's advanced directives had said no to a ventilator, but now with COVID, they may need it to get oxygen. Has COVID changed that conversation at all?
So it's a really great question. COVID is changing all of our conversations in healthcare right now. And the answer that I would give you today is different than the answer I would have given you in March or April, as we are kind of learning more about COVID. I think when you're thinking about COVID and ventilators in the time of COVID in particular, ventilators in general can be very helpful if we know that you have some sort of a reversible process that you can recover from, and that you need time to let the lungs rest and have the ventilator work for you. And COVID sometimes is one of those situations where patients need to be on a ventilator to have their lungs rest and recover and deal with the virus on their own, and then they come off of the ventilator and do very well. We have patients, unfortunately, who go on ventilators and either never come off ventilators, or who need increased support, or who have a trach placed and kind of need permanent ventilation. And it's hard to say who is going to go one way or the other. There's a lot of media discussion, especially earlier, about the young, and in particular older patients being at higher risk, and those with other medical comorbidities. And those are certainly patients who are at higher risk, but I unfortunately see patients who don't fall into those categories, who need ventilation and don't do well from it. So it's really hard to predict who's going to do well. I think this is really where a lot of it comes back to talking with your loved ones about what is important to me. If I get put on a ventilator and after a certain period of time I am not showing any signs of recovery, and it does not look like I will be able to come off of the ventilator, do I want to have what's called a tracheostomy, which is a more permanent ventilator that is put in the throat so that you can have a safe way to ventilate for a long period of time? Would I want to have that placed and to be on a ventilator and potentially be in a facility for the rest of my life? And the answer to some people is yes, and then that's the kind of treatment approach. And to some people, they think try me on the ventilator. If it's not working and we're starting to talk about a trach, then I don't want that. And there are some people who would say, don't put me on a ventilator at all. So I think it's really kind of talking with your loved ones, not just about the decision to intubate and put on a ventilator, but if you are in a situation where you're not showing the recovery that we hope to see, what is a meaningful quality of life to you? Is it that you want to be here and be awake? And if that means that you have a ventilator and need to be in a facility, that's an appropriate or an acceptable quality of life, then share that with your loved ones, so that when we in the medical field get to a point where we're seeing those things, and you can say, oh, we've talked about it, and they said they would want a trach, they would want, you know, the time to see if they recover, versus that's not something that they would want. But yeah, COVID is really changing how we do so much in every part of our life, not just in healthcare. Do we have anything else?
I think that is it for now, but just a reminder
Okay.
for folks here on Zoom, feel free to submit questions through the Q&A or through the chat. But Zach, you can move along to some of these resources.
Great. So this is a website that I really like, and I encourage all of my patients to use. It's called Prepare for Your Care, prepareforyourcare.org, or you can just Google Prepare for Your Care and it'll come up, and it's this nice one with the yellow and the sunset. And this website does a couple of different things. So when we were kind of talking earlier about how to broach the conversation with your loved ones, so they have all sorts of kind of videos in here. So you can see they go through the different steps, and within them, you can go through and do these. So they have all sorts of different videos, and you can kind of see other people having the conversation, see other people talking about, you know, what's important to them, and you can watch these. I encourage people to watch these with their loved ones and talk about it. And then they have, you know, different information about healthcare decision makers, about, you know, what's important to you, things like that. So I think this is a great resource to watch, to help you to kind of start to think about what's important. And they have a lot of really great videos. And then after you either watch the videos, or if you feel okay kind of just jumping into filling out an advanced directive, you can go into the advanced directive, you can use it as a guest, and then you can choose your state, and they will get you an advanced directive. So we're in Pennsylvania. So you can fill it out online if you would like. I usually just kind of print it for my patients. They have it in English and Spanish. And this is kind of what they come up with. So the reason that I like this is because it's not just a checkbox of, I want a ventilator, I want antibiotics, I want blood products, I want this. It kind of really goes through what's important to you. They talk a little bit about some of the decisions that you may need to make, things like CPR, a ventilator, dialysis, a feeding tube, surgery, things like that. So you kind of get to name your medical decision maker. And then you can say, you know, do you give them some flexibility to maybe deviate from this document a little bit, which I think is, I generally encourage, because like I said, we can't plan for every scenario that comes up. And then it kind of talks about what's important to you. How do you like to make your medical decisions? What are some of your hobbies? What brings you joy in life? And then it kind of gets into what's most important to you. Is it to live for as long as you want, no matter what? Meaning, you know, if you need to be ventilated and have a tracheostomy and a feeding tube and be in a facility, but you are alive, and that's most important to you, versus focusing on quality and being comfortable and maybe not having the longest life. Where kind of in that spectrum do you fall? It kind of talks about, you know, at the end of life, what's important to you. So this document I really like, because it's not just, I want a breathing tube, I want a feeding tube, I want this. It kind of really talks about what's important to you. Do you want to, as we were talking about the ventilator, do you want to try and stay on life support machines if you need to? Do you want to try them? And if you're not getting better on that ventilator, then to stop your life support machines? Or do you not want any life support machines at all? So this is my favorite document. This is what I tell patients to use all the time. And then down here, and it goes through your witness, who you need to witness as well. So this is really wonderful. This is, again, from prepareforyourcare.org. And this is what I would definitely, if you don't already have an advanced directive, this is where I would recommend going and filling out online or printing and starting to talk to your family members about it. I think I saw a couple questions come in, so we can answer those.
I just shared with
comments
folks in the chat that for folks who are on Zoom and who had registered, and so I have your email address, I will send these links out that Zach is sharing.
Great.
Anyone on Facebook, I'm not able to tell who all is watching us on Facebook, but feel free to shoot me an email, and I will make sure that you get all these resources from Zach.
And then in terms of kind of getting the conversation started and having the conversation, this is from a California organization, the Coalition for Compassionate Care. And this is a guide for group discussions around end-of-life care. So this can be a really nice way for you and your friends to get together over a meal or a glass of wine or a cup of coffee and kind of start to have these conversations about, what is important to you, and really, like I said, try and normalizing it some, that this is, this doesn't need to be, it is a big scary thing, but it doesn't need to be, and we can try and normalize it as much as possible. So this is the guide itself, and you don't need to be a medical professional by any means to guide this conversation. You don't even need to read all this. They have some really nice, like one of the first things you can talk about is views on dying. So they have different quotes from different people, and sharing those quotes, and what is your reaction? What are your thoughts on that quote? There's one from Mitch Albom who says, don't let go too soon, but don't hang on too long. What are your thoughts on that? How do you feel about that? So this can be a really great resource at kind of starting the conversation. So it goes through, personal reflection. So thinking as a group about, who was the last person who you saw die? How did they die? Would you kind of make similar decisions for yourself? Would you make different decisions for yourself? So this from the coalition is a really great resource. And I think, there's an organization called Dying Over Dinner or Death Over Dinner, which is trying to normalize. And it's about having a dinner party where you talk about these things, and you talk about what would you want the end of your life to look like, and really trying to normalize it. So I think this is a really nice one to grab a few of your friends and virtually now have a drink or dinner or coffee or just talk about it. Another resource that can be helpful is from this elder care group, and this is kind of talking about care at the end of life or making medical decisions. This goes into some kind of legal and financial things as well, which I'm sure are of interest to some of you, but is not my area of expertise by any means. But they give you, if you want to do something less formal than sitting down with your friends and talking about it, they give you some phrases that you might want to use with your loved ones to open the conversation. I was thinking about what happened to whoever, and it made me realize, or I need your help with something. So this is good. And they kind of go through, again, different things that you can talk about and some different information. So these are some really great resources to help you to have the conversations with your loved ones. I think that's really all that I had prepared for you guys. This is just, again, the prepareforyourcare.org, which can help you to get an advanced directive and start the conversation. I definitely recommend looking at this website and then this coalition. That can be really helpful to kind of start conversations and explore them with your closest loved ones. And then here's just kind of some other general, most of these I had showed you, but just kind of some other things. Elder Care, Plan for Your Lifespan, Practical Bioethics has, some other resource guides for having the conversations themselves. So that's what I had planned for you guys. I hope that this was helpful to at least get your minds thinking about it, and hopefully, not too stressful, because this is a big conversation, but the more that we can make it stress-free and a normal part of our not everyday conversation, but the conversations we have with our loved ones, the better they will be equipped to take care of us if we can't speak for ourselves.
This has been really great. Thank you so much, Zach. I'll give it another minute if folks do have any questions that we hadn't covered that you want to throw into the chat or the Q&A. One question that I know also sometimes comes up, Zach, is where do you need a lawyer versus what can you do on your own versus what you do with your healthcare provider? So is there a place that anyone would need to be talking to a lawyer about anything specific to the advanced directives?
For the advanced directives, they're not. And that's a really great point. A lot of times I'll hear from patients like, oh, I'm getting around to it. I need to get to a lawyer. And like I said, you can go to these websites, you can download these forms, you can fill them out, talk to your family about it, get the appropriate witnesses to sign it, and that is a valid legal document. So in terms of healthcare decision-making planning, you do not need a lawyer at all. I don't know, financially, things like that you may, but for healthcare, go to the website, print the document, fill it out, get it signed appropriately, give it to your loved ones and your doctor or your healthcare provider, and it is a legal document in that sense.
Great. Thank you so much for that. I think we have covered all of the questions. I'm just looking at Facebook again to make sure nothing else has come in. But Zach, thank you so much for taking the time with us today. I'm sure things are crazy right now over at Jefferson. And so credit to you and all of your colleagues there for all the work you're doing right now with this new surge of COVID in the city. I know it is quite a lot on the healthcare system right now. Thank you for folks who joined us today, either on this Zoom or through Facebook. We are taking the month of December off from our Doctor is In programming, which is just because we have typically done it that way as things get busy around the holidays. But then also looking this year, again, things are, I'm sure, quite hectic over at Jefferson. But we will pick back up in January with our Doctor is In webinar series. So keep an eye out for announcements about our upcoming winter webinars through this Doctor is In series. And again, I will send those links out to the folks who are on the Zoom to share some of these resources that Zach had given us this great overview of. Thank you, Zach. Thank you, everyone, for joining us. Stay well, stay healthy, stay safe, and
thank you, everyone.
we'll see you all again soon.